is for IV push. I'm not going to do medication reconstitution since I submitted that in a different video. And also I'm going to just pretend to use the alcohol wipes as I'm running a little bit low. I will start this skill with checking the patient's record in the computer system. I will check for food or medication allergies, any lab data that needs to be monitored or is pertinent, any factors such as NPO, PPE status that would affect the medication administration. Then I will verbalize the type of drug that's going to be given, the reason why it's going to be given, any adverse effects that I should advise the patient of or be aware of myself, and any factors for the medication administration. Then I'm going to verify compatibility of the medication, the normal saline to be pushed with the IV fluids already running. I will go to the computer system and acknowledge any intra-agency orders not yet acknowledged. Then I will locate the medication to be administered and maintain the 5 rights of safe medication administration, including the right patient, the right medication, the right dose, the right route, the right time, and expiration date. I'll perform any dosage calculations, including rate per minute that the medication will be pushed at. Then I will gather my supplies. I'll enter the patient's room, provide for privacy, introduce myself, perform hand hygiene, use 2 patient identifiers to identify the patient, and explain that I'm going to be pushing some medication through their existing IV line. I will assess for allergies, making sure that they don't have an allergy band for which the medication is not listed in the computer system. And I will also assess for pain. I will assess their IV site for any infusion reactions, phlebitis, and patency. Then, if all of that looks good, I will scan the patient's wristband and I'll scan the medication to be administered, which is the second check of safe medication administration. Then I will prepare the medication. I will perform hand hygiene again. Remove the top of the medication, cleanse the vial, allow it to dry. We'll make sure that the needle is firmly attached to the syringe. Draw up the same amount of air as medication to be administered. Inject the air above the medication line. Invert the medication and draw up the correct amount of medication, verifying that there are no air bubbles and that I have the correct amount. I will recap the needle for sterility. Again, reconfirm that I have the correct medication amount. Then I will check the patient's vitals as indicated. And after that, I will perform the 3rd check of safe medication administration. I will explain to the patient the medication I'll be giving them, tell them why I'm giving it, explain any adverse reactions that they should notify me of, and allow them the right to refuse. If they don't refuse, perform hand hygiene, don clean gloves, then I am going to cleanse the INT port. Aseptically connect it, aspirate for blood return, and then slowly push 3 milliliters of normal saline into the tube. If the patient reports any pain or I meet resistance, I'm going to stop and assess the reason. Otherwise, I'll continue push. I'll cleanse the port again. Attach the medication, and I will push it at the rate per minute that I calculated for this medication. Cleanse my port again. Then I'm going to slowly push 5 milliliters of normal saline into the line. I'll start the first milliliter 2, at the same rate as the medication that I pushed until it clears the line. Then I can increase the speed a bit, but I want to continue slowly. Then I will dispose of all of my sharps in the sharps container. I'll remove my gloves, perform hand hygiene. I'll take the patient's vitals again as indicated. I will reassess their IV site to make sure that there's no infusion reaction. Then I will perform the final 4, including making sure the patient is safe and comfortable, that they have their call light, ask if I can do anything else for them. I'll perform hand hygiene again. Then I'm going to document per agency policy about the medication administration, and I will reassess the patient within 30 minutes or the indication of the medication.